Hi folks, it's Matthew Long here from the, where do I work? Oh yes, the Mind and Body Clinic in here in Bury St Edmunds. Just got straight out of my head there for some reason. Now, I posted before that I was going to be coming on live today at 10:30. I'm a minute or so late just due to phone calls. And we're going to talk about the ITB, the truth about the ITB, how it can be treated effectively, and some of the myths and the falsehoods about the ITB. Now, I do have a list, so if I'll keep you looking down, then I do apologise. If anyone's got any questions, please post them up online. I can see the screen here to my left, and I can answer the questions either live, or I can just go through the questions I've already had about it, or not so much questions, some of them, but things that reoccur in the clinic with people's understanding of what the ITB, the Ilio Tibial Band, is, and what problems they're having with it. Now, the fact about the ITB, the first fact, it's a tendon. It's a tendon that runs up the side of the leg, okay, and as it's a tendon, it doesn't stretch. Science, medical books would state that a tendon can stretch up to 5% of its original length. Now, the IT band up the side of the leg is quite a long length of tendon, so you might be able to stretch it possibly a good centimetre. But of course, being a tendon, it's just going to go straight back to its original length. It's like a big elastic band, big rubber band. It's just going to go straight back to its original length. Now, got a lovely diagram here for a little bit of anatomy. Here we go, and it's the right way around, hopefully, for you all to read it. Okay, so hit this nice bit here is the IT band running down the side of the leg, connecting just below the knee joint on the lateral side of it. As you can see, we've got two muscles, two main muscles which connect to it, which can cause or give you the impression that it is tight. Got the nice TFL muscle here, that one up there, slightly round to the front of the side of the leg, and that's the tensor fascia lata. Now, that can help with hip flexion, but it also helps with the stability of the leg and the knee joint, along with the ITB. The glute max, we all know where the glute max is, big chunky bit of muscle on the backside, and that also is connected to the ITB and can give the impression that the IT band is tight. So if you're going to stretch anything, you want to stretch those two muscles. Now, one of the other muscles that comes into play that a lot of people think they've got problems with the IT band, but it's not, is the Vastus Lateralis muscle down the side of the leg. It's one of your four quad muscles. Okay, it's the furthest outside. Now, the Vastus Lateralis muscle actually tucks underneath the IT band slightly. So when you're putting pressure on the side of your IT band and it's a lot of pain, it's not the IT band that's causing the pain. It's the Vastus Lateralis muscle underneath that is causing the pain. So anyone who foam rollers down the side of the leg and creates loads of pain, it's not doing you any good. It's just no point whatsoever. If you were going to do some cross fiber rollings where you just angle the roller 45 degrees as it's rolling up the side of the leg, then you're going to get into myofascial work, which will help release the fascia between the ITB and the Vastus Lateralis muscle. Now, causing all that pain, all you're doing is squashing the Vastus Lateralis muscle between two hard surfaces. First hard surface is the IT band itself. The second hard surface is your femur, the big bone in your leg. So squashing it all together, not doing you any good whatsoever. So when it comes to massaging, when it comes to treating the side there, if it feels tight, I say feels because it's not actually tight. If it feels like it's tight or it's not moving, it's got stuck, it's got stiffness in it, then a lot of cross fiber work coming from the Vastus Lateralis down behind the leg, pulling the IT band away from the muscle can actually release it quite a lot. If you're getting knee pain, the chances are then you've got tight muscles in the glutes or the TFL muscle, the tensor fascia lata. So with trigger point therapy, soft tissue release work, acupuncture, any of those, we can start releasing those muscles off that are attached to the IT band. And it's a lot less painful than rubbing your hand up the side of the leg, which some sports massage therapists and some physiotherapists seem to like to do. They seem to think the pain is good, when in fact it's doing no good whatsoever apart from causing pain. If you like pain, then it's doing you good, I suppose. But otherwise, personally, I don't like it. I would rather someone did some serious cross fiber work where you can actually release the muscle, you can actually release the IT band away from the muscle, get the fascia moving, get the fascia lubricated through the fascial work, and it's going to be a lot less painful, and it's going to be a lot more effective. Now, a couple of other facts I've got written down here that we can go through. The IT band will not increase in resting length. I mentioned that already, actually, that it will stretch slightly, but it will always go back to its original length because it's just a thick tendon. So if you're going to stretch anything off, glute max and the TFL. Got another question here, or another statement. The IT band is a primary source of outer thigh stiffness or discomfort. That is false. Again, this results in the fact that it can get stuck to the vastus lateralis, your quad muscle. So if it's feeling stiff and tight, it's more likely to be the muscle, not the IT band. Okay, knee pain then. The knee pain that you can get on the lateral side of your knee joint. Some people think it's the IT band. Now it does connect just below the knee joint, but the thickest part of the tendon, the thinnest part of the tendon is just above the knee. And that's quite often where you get the knee pain. So it might be a couple of centimeters just above the side of the knee joint. And if you're feeling the pain there, then it's likely to be that the ITB has been strained, or it might be again the quad muscle, not the quad muscle, the glute muscle and the TFL are pulling it tight. So you're forever getting that extra tension on the thinnest point of the tendon just before it joins into the side of the knee. So that's the knee pain. Chances are it's going to be something else. It's not unlikely. That's the wrong word. There are other things that can go on with the knee that might not be the ITB. So it needs to be investigated carefully. Patellar tendon syndrome is another one that can give lateral knee pain. But you know, you need to get that checked out. And of course, you can have meniscus cartilage problems and other problems. Patellar tracking problems as well can cause pain in the knee. So you need to be careful to I say diagnose, work out exactly what's going on with the knee joint to make sure you're going to be treating it correctly. Okay, so should you foam roller the ITB? Pretty pointless. It's a tendon. It has low blood flow, so it does take longer to heal. So just foam rolling the ITB is not going to do you much good at all. You need to concentrate on foam rolling the vastus lateralis muscle. You can foam roll the TFL and the glute max as well, of course. And the way to reduce the pain when foam rolling the side of the leg is just to angle your foam roller at 45 degrees, and that way, as it goes up, it's going to be pushing the fibers sideways rather than straight up up to the top of your leg. Okay, what else have we got then? I already mentioned what causes the pain. Had that question. What causes the pain when you're foam rolling up the side of the leg? And that, again, as I mentioned earlier, is the two hard surfaces. The ITB itself pushing the vastus lateralis muscle, squashing the vastus lateralis muscle against your femur, your bone. So pretty pointless in squashing that just for pain's sake. So the IT band is a tendon, doesn't stretch. Glute max, the TFL muscles, they're attached to it. They can give impression that the IT band is tight. So stretch off those muscles and get those muscles treated first before you just cause yourself a load of pain. Knee pain, normal pain for the IT band is just a couple of centimeters above the outside of the knee, but it can get other knee pain further down as it passes the outside of the knee joint. But that's the classic point for knee pain. The IT band's function is stability. It's stability of the knee joint when you're running and walking. So if you get pain down that side when you're running, but when you stop and rest, the pain goes, it's a good chance that it could be the IT band. Okay. If you've got internal structural problems with the knee, just stopping running alone will not make the pain go away. You usually get pain, swelling and stuff afterwards. So if you have pain when you're doing your exercises, it disappears as soon as you stop, then of course it could be the IT band. So are there any questions? I'm on for another couple of minutes. Any questions about the IT band you want to know, then please fire away. And I'll just make sure I've covered everything I needed to cover. Okay, the IT band healing the IT band, it does take a lot longer because it's a tendon. It does take a lot longer than normal muscle. Okay, so the IT band, You need to encourage the blood flow to the area. Hot and cold treatment can help with that, getting fresh blood supply to the area. Massage, of course, will help with that. Friction massage, vibration therapy, if you've got something that has got the right sort of vibration impact on it, that can encourage blood flow to the area as well. And of course, there are some quite expensive treatments, sonic treatments and all sorts out there that you could use as well. But to be quite honest, one of the best ones is good old-fashioned massage, some deep tissue work, cross fiber work, not straight into it because it's going to be painful, and you can encourage the blood flow that way. And it will take longer than a normal muscle to heal, so bear with it. If you've got a particular sore spot, ice will be great with that because you'll take the inflammation away, and of course, as it warms up, you'll get fresh blood supply into the area as well, which will encourage the healing process. So, don't seem to have any more questions, which is great. Thank you for taking part and listening. And if you do have any questions afterwards, then please get in touch. I'm going to put a link up to my YouTube channel as well. If you'd like to subscribe, that'd be fantastic. And you can see other videos like this, and also videos about the clinic and hypnotherapy, as well as treatment of muscles and joints, etc. Okay, thank you for listening. Thank you for watching.